So just wanted to give a little context here. So Taiwan is a democratic country about 81 miles off the coast of China. In January this year, it had its presidential election, and where 75% of the people voted. So this talk is about Taiwan's response to COVID-19 based on a JAMA paper. And you can look at for details. There are 124 action items that's described in the paper. So after SARS in 2003, Taiwan has been thinking about how to prepare for the next epidemic. And so it had passed a series of amendments to its Communicable Disease Control Act. That includes trying to keep track of all the protective equipment stockpiles, setting up a national health command center for coordinating government agencies, uh, putting together a set of regulations for gathering, entry, and exit of people and traffic. Uh, Also amend the law so that there's penalties for violating home quarantine and isolation. And then, for the purpose of this talk, a set of laws to track and manage people under infectious risk, and also allows geographic location and total number of patients to be made public in an aggregate manner. And then finally allows the public property, including military camps and so forth, to be used and facilities to be made for essential equipment. So here is the Taiwan's National Health Command Center. So as you could see, it has a room for different data analysts to get the data from different local and state national governments and internationally. It has a media room to report to the public what they're doing, and you could also sleep there because it is a lounge. So it's a 24/7 operation that could host 100 people. So this is what it looks like, and this is what's happening right now. From the data, they have a national health insurance stockpile system, the National Health Insurance Infectious Disease Statistics System, and the media surveillance system, all in the command center. So the first thing that Taiwan did this time was to recognize the crisis. And so immediately after December 31st, when there was a report of a suspicious coronavirus coming from Wuhan, Taiwan immediately sent people onto the airplanes that were coming from Wuhan to check for their symptoms. And on January 20th, they activated the command center and had a national security meeting convened where all the ministries are supposed to act really quickly. So this is how they do it. They boarded the flights to make sure that people won't bring in and having fever and coming into the country without being checked, because there was suspicion of human to human transmission. So when people landed, what they did was they scanned a QR code. The QR code would lead to an online declaration form. And an online declaration form, uh, you fill out your travel history, where you have been in the last 14 days, and if you've been to a hotspot area or not, no. And also you fill out your symptoms, cough, respiratory symptoms, or signs of fever. Then you fill out your cell phone number and the place that you're staying. Uh, in Taiwan. So if you didn't travel to a level 3 alert country, like if you didn't come from Wuhan or in later on South Korea, you will get a SMS sent to your phone that says you passed. So you could go quickly through customs. Now, if you went through high alert countries, level 3 countries, you need to do a 14-day quarantine. So during the 14-day quarantine, they will bring you food. They will track you to make sure you didn't go outside, and to make sure that you didn't get on the metro and infect other people. And then later on, they start paying people under quarantine with the daily wages equivalent to GDP per capita. What they also did was they linked the National Health Insurance database with the Customs and Immigration database, so that when the doctor sees a patient in clinic, the doctor will be alerted, or the nurse will be alerted, that this person has traveled to Wuhan. So then they will be putting on protective gear. Basically, they will triage them separately, and then they will have index suspicion for COVID-19, and they order a test if it's necessary, if they believe that there's enough evidence that this patient might have that. So this way, they allowed them to quickly get at the people through their system. So this is a picture of the alert at the point of care when a doctor sees a patient coming from level 3 alert countries. What they also did with the data is that they immediately got a quick count of the nation's stockpile. So on January 20th, they told people there are 44 million surgical masks, 1.9 million N95, and 1,100 negative pressure rooms. So what that tells people is people did a quick math, say, 44 million surgical masks. Taiwan has 23 million people. Well, that's less than 2 masks per person. So then the next day they said, well, we are going to ban mask exports to outside, and we have to make more. So then what they did was they got all the best engineers together to hack out 60 different supply lines, and they immediately got the raw materials necessary to make masks. So they increased the mask production from 2.44 million units per day to now 11 million per day. And as of today, they are going to be donating masks to the United States. So this is what they did with the Diamond Princess cruise ship. So this ship actually went to Taiwan on January 31st before it went to Japan. When it got to Japan, they would discover that there were numerous cases. So people in Taiwan started to panic. So what the government said was that, okay, we'll give you the 50 places where the visitors from the Diamond Princess had been, and then they will send text messages to people who had been in that vicinity based on their cellular data. So that this is on the right, this is the text message they will get in. If you have been to the following places on January 31st from 6 a.m. to 5:30 p.m., you could check out this map and then call the number 1922. So the government will check on you. This is a map of the masks. So they created an app for people to track whether they could buy masks. And then even they have an inventory. The green is, if they still have 50% inventory. So the government for each store give them 600 masks per day to sell. So you could track the closest location to you to get the mask. They also monitor temperature for buildings. So if you walk in and you light up, then you can't get in without getting additional checks. Then they communicate with the public daily. The government now has 90% approval rating from the public for the handling of the crisis, and it's got the lowest per capita infection rate and death rate in the world. So they need to continue to monitor it. Most recently, they have people from the US and Europe going to Taiwan because it's safer there. There must be a balance between emergency power and maintaining civil liberties, which I'm currently working with Michelle Mello in the law school to do that, to better understand that. Basically, they've worked on logic and sequence and tempo, when to do things fast, and then articulate it to the public. And that's what they have done. Thank you.
Thank you very much, Jason, for that great glimpse of what happened and how it was managed in Taiwan.